Welcome, viewers. Today is another edition of Health Talk on Insight Links TV. I am Damilola Jolayemi. Today, I'll be talking on tuberculosis. Tuberculosis is an infectious disease that affects the lungs, though it usually affects other parts of the body, and it can develop when there is bacteria in the droplets spread through the air. Though tuberculosis can be fatal in most cases, but it is preventable and manageable. Causes of tuberculosis. Tuberculosis is caused by Mycobacterium tuberculosis, and these occur when a person with active tuberculosis case sneezes, spits, laughs, or talk. I want you to know that this can only occur when a person with active tuberculosis spread the bacteria. Now, let's discuss what is the difference between latent tuberculosis and active tuberculosis. Active tuberculosis, this one occur, and this can cause tuberculosis when the person has tuberculosis with symptoms and it is not treated. But latent tuberculosis, a person can have tuberculosis, but the person might not develop the symptoms because the immune system of such a person contains bacteria, so they do not replicate and cause the diseases. Though latent tuberculosis needs to be treated also. Now, let us discuss those who are at risk of developing tuberculosis. The risk of developing tuberculosis is higher in people with weakened immune system, such as the HIV patients. They are at higher risk of developing tuberculosis. And those who have tuberculosis for the first 2 to 5 years of their life, they are at higher risk of developing tuberculosis. The older adults and young children too are at higher risk of developing tuberculosis. And those who inject recreational drugs. Recreational drugs, these are chemicals and substances that people use for enjoyment or for leisure purposes, but not for medical reasons, such as cocaine, heroin, etc. These people are at higher risk of tuberculosis, and those who do not get appropriate treatment for tuberculosis when they have it. What are the early warning signs of people with tuberculosis? Tuberculosis, as we know, people term TB. What are the early warning signs of people with TB? When someone has a persistent cough lasting for at least a week, those are the signs of tuberculosis. And when a person has phlegm, which has blood in it when they cough, these are also signs of tuberculosis. When a person feels general fatigue all the time, these are also signs of tuberculosis. And when the person has loss of weight or appetite, loss of weight and appetite is one of the signs of tuberculosis. Night sweat, fever, etc. are also signs of tuberculosis. We'll be going on a short break now. When we come back, we'll be discussing the prevention and treatment for tuberculosis.
Day by day, governance is becoming more meaningful in Osun as dividends of democracy are delivered to the people's doorsteps. Governor Isiaka Adegboyega Oyetola has continued to put smiles on the faces of old and young. Active civil servants now receive new minimum wage, while pensioners also smile to bank at end of every month. Artisans and market women now praise the governor. Osun is now witnessing a holistic development in education, healthcare, economy, agriculture, and tourism. Osun is now the choice location for businesses for both local and international investors. The state under Oyetola is giving priorities to people's needs despite the paucity of funds, as projects are commissioned at intervals. Gboyega is working, Osun is progressing.
Welcome back from the break. Tuberculosis is still the topic of the day, as we've discussed what tuberculosis is all about, what causes tuberculosis, the differences between latent and active tuberculosis, risks of tuberculosis, and the early signs of tuberculosis. Now, we'll be discussing prevention and treatment of tuberculosis. How can you prevent tuberculosis? You can prevent tuberculosis by staying away from people with active cases of tuberculosis to avoid being infected. You can also wear face masks when you are in the midst of people who cough, sneeze, or spit, because they might be with active or latent tuberculosis. Now, what are the treatments for tuberculosis? You need to get adequate diagnosis and treatment for tuberculosis. As I said earlier, tuberculosis can be fatal, but it can be treated and managed. You need to get the right type of antibiotics for you to treat tuberculosis, because tuberculosis is spread through a bacteria, Mycobacterium tuberculosis. That is what causes tuberculosis. You need to get a right type of antibiotics, and the length of treatment is very, very important. And the length of treatment depends on the age, it depends on the overall health, it depends on whether the tuberculosis is active or latent, and it depends whether the strain of tuberculosis is resistant to drug. That is all on Health Talk today. I want you to know that tuberculosis is real. Do what you can to prevent and treat tuberculosis. Do what you can to know those who are at risk of developing tuberculosis and know the early signs of tuberculosis. See you next time for an interesting topic. Bye.